In the last video, I talked about one of the major complications of Kawasaki disease, one of the major problems with the inflammation of the cardiovascular system that occurs during that disease is the formation of aneurysms in the coronary arteries. So, what is an aneurysm and why is it bad? Normally, a blood vessel can handle the pressure supplied to the blood by the beating heart, expanding just a little bit to handle the pressure. When the blood vessel gets weakened, it can balloon out. Now, if it's not stretched beyond its limits, then the vessel can return to normal or is only slightly dilated. Still an injury to the blood vessel, but on the grand scheme of things, not as bad as the other end of the continuum, where the blood vessel gets so weakened that it actually breaks, it ruptures. And this is essentially a medical emergency. In between these two extremes, the blood vessel is stretched out such that it can't return to its normal size, so it stays ballooned out a bit, and this is an aneurysm. Now, there are three main complications of aneurysms, and the likelihood of these problems occurring appear to be directly related to the size of the aneurysm relative to the normal vessel size. If the aneurysm continues to grow or destabilizes, then it can lead to rupture, and within the aneurysm, the blood will pool, and this stagnation can start the blood clotting process or thrombosis. So clots can grow at the point where it blocks off the blood flow, or they can break off and move downstream, again blocking the blood flow. And finally, the body can attempt to block off the aneurysm, which causes a narrowing or stenosis in the artery, and that can block off blood flow. In both cases, the end result of the process is something that reduces or blocks blood flow, called an occlusion, reducing oxygen being supplied to wherever that artery led. Now, in the short term or the acute phase, there are a couple of things doctors can do for these problems. In the case of rupture, surgery can be performed with a doctor placing a metal clip at the site of the rupture to close the hole, or plugging the section of the rupture and putting a new tube or a bypass graft around it. In the case of thrombosis, there are drugs that can break up the clots called thrombolytics, or put a bypass around it. For the case involving a coronary artery, this bypass is called the coronary artery bypass graft, and it's the bypass surgery you've likely heard of before. In the long-term or chronic phase, when there isn't an immediate problem with these complications, then people with aneurysms may have further medical management, surveillance and monitoring to check and see if the aneurysm is stable, whether or not occlusion is happening, and whether or not reduced blood flow is actually affecting the brain or heart. In some cases, drugs will be given to prevent clotting, so anticoagulation or antithrombotic drugs, and perhaps even drugs like beta blockers to reduce the oxygen requirements of the heart. And of course, doctors will emphasize that someone who already has experienced injury to the blood vessels would do well to pay attention to things associated with cardiovascular disease, like more of the good, like good foods and exercise, and less of the bad, like smoking. So in the next video, we'll go into more information about the treatments available for aneurysms.